How's it going, guys? We have a medium difficult question for cardio step 1 internal medicine surgery 2CK 8-year-old boy. Oxygenation of the chambers of his heart and his vessels are shown. Question wants to know what's the most likely diagnosis. Now, a nearly identical diagram shows up on the NBMEs for step 1, and the same type of question, although step 1-esque clearly, also shows up on 2CK. So let's just hop to the answer choice here. Choice A, congenital rubella syndrome, wrong fucking answer. You need to know that this is the highest yield cause of PDA, panic ductus arteriosus, and USMLE. What does a PDA do? It connects the descending aortic arch to the proximal pulmonary trunk. And post-birth, that's going to be a left to right shunt, high pressure to low pressure. So we would have oxygenated blood coming from that descending aortic arch to the proximal pulmonary trunk, which we know is fucking wrong, because if that were the case, we would have a step up in oxygenation between the right ventricle and the pulmonary artery here, which clearly we do not. You need to know that you close a PDA with an omethicillin NSAID, you keep it open with prostaglandin. Wrong fucking answer. Choice B, Edwards syndrome, wrong fucking answer. This in here be asshole. Okay, so this is fatal in utero or shortly after birth. Kid would never make it to 8 years old. And even if there's one case on Google, I don't need you commenting on it below. The point is, kid's way too old to have Edwards syndrome. Now, Edward, heart defects, not a salient point for USMLE. This would be rocker bottom feet, clenched hands, overlapping figures, micronathia, prominent occiput, low set ears, obviously trisomy 18. But if we had Down syndrome in contrast, where we could have endocardial cushion defects, that could be AVSD, ASD, VSD. That could obviously make the question more complicated and would conflate with the correct answer here. Point is, wrong fucking answer. Choice C, maternal lithium use, wrong fucking answer. So obviously treatment for bipolar disorder that if the mom takes during early pregnancy in particular can cause Epstein anomaly in the fetal heart, which is known as atrialization of the right ventricle, where the right ventricle is tiny because the right atrium is massive. Now, if we were to look at a diagram in that case, we could try to just state a possibility for what it could be, but wrong fucking answer. Choice D, pulmonary hypertension, correct answer. Now, what's going on here? Well, we notice that we have a step down in oxygenation between the left atrium and the left ventricle, which is impossible unless we have a right to left shunt across a VSD here, i.e. Eisenmenger syndrome. Now, VSDs are not cyanotic at birth. At birth, they are left to right, high pressure to low pressure, where over time, that increased volume moving from the left ventricle to the right ventricle has to pass through the pulmonary circulation. Well, the pulmonary circulation is going to become more musculature at the tunica media to compensate and prevent excessive flow, where we get pulmonary hypertension. So that greater preload over time initially is going to cause compensatory afterload. Pulmonary hypertension backs up to the right ventricle, right ventricular hypertrophy, shunt reverses, right to left. That's Eisenmenger syndrome. So USMLE likes you knowing that the most upstream etiology for Eisenmenger syndrome, a reversal of that shunt across the VSD, is pulmonary hypertension. So they'll say, which of the following is the most likely cause of Eisenmenger syndrome in this patient? Students select right ventricular hypertrophy. It's actually wrong. The correct answer is pulmonary hypertension. Okay, so let's just hop through the other answers here. The final answer here, rheumatic heart disease, wrong fucking answer. Obviously, mitral regurg acutely, mitral stenosis late. So clearly, if you're not sure what's going on here between the left atrium, left ventricle, where the mitral valve would be, you could start thinking about, well, I know rheumatic heart disease affects the mitral valve, but wrong fucking answer. You know the deal. I'm just going to make more content. If you like my stuff, subscribe my channel. And I appreciate your time. That's it.